Good?
See a second. Yeah. We're good.
All right, good morning. Thank you all for coming out. We are honored this morning to have Senator Reed join us, but also a few comments from staff. And, I was thinking over the last couple days, Senator Reed goes back, we were here about 8 years ago for a groundbreaking on a cold, gray day like this. And he was here even before when this was a real operating printing plant. But over the time, we have not had a better friend in the Senate and in DC than Senator Reed as far as knowing the need for health care and supporting the ACA when it was accepted in 2014. And so we're very fortunate to have a stable, you think of all the craziness in DC, Senator Reed's stable, keeps steady, right? Fighting against the tide. But he's also supporting this year our refunding for community health centers across the country as well. That's coming up in this year's budget. And I don't think it's a controversy, but you never know what's going on with the budget anymore. So we appreciate his behind the scenes pushing for sanity and a real regular process. And 30 million people get their care at health centers across the country. So we want to make sure that continues. So he's working on that as well. So thank you, Senator, on that. So first this morning, we do want to talk about the ACA a little bit because it's still under attack. Here we are 5-6 years later and it's still under attack. Hundreds of thousands of people here in Rhode Island, 100,000 at least more have insurance, and millions across the country, and yet people are still trying to say it's not working. It is working. And it's working here, and we're an example for the whole country, but it's working in a lot of places. So we want to make sure we maintain it. So Karen, you want to come up and say a few words for us? Karen Malcolm.
Thank you. My name is Karen Malcolm, and I am the coordinator for the Rhode Island Protect Our Healthcare Coalition. We have 23 leading organizations, including the Community Health Center Association, the Economic Progress Institute, the United Way. So we've got some big players on our side on this. I'm not going to give a lot of numbers. It is true that the Affordable Care Act is working in Rhode Island, and it is working nationally. Whether you think about folks who for their life had gone uninsured, who are now covered under the ACA's Medicaid expansion, or if you think about the folks with pre-existing conditions who had difficulty accessing coverage even via their employer because of a chronic condition or significant illness. I want to remind us what life was like before 2014. You all at the mental health centers also benefit. Yes, you all at the community health centers here in Rhode Island saw frequently people with means to purchase insurance, but who had come up against things like annual and lifetime caps. So in the midst of undergoing important treatment, life-saving treatment for cancer or heart disease, would come up against one of those caps and be told by their insurer, sorry, we're done for the year. Well, I'm not done. I still am facing this condition. I want to talk about one person whose story, we have hundreds of Rhode Islanders who support our work at the Coalition. And many of them have contributed their own personal stories to our story bank. And I encourage anyone with a story to go to protecthealthri.org and share your own story. But this is a story of a young woman who had become unemployed. This predates the Affordable Care Act. She had become unemployed. No surprise, 2008, we all know what happened. She went for a year before she was able to be reemployed. She could not afford to purchase coverage under her former employer's COBRA. And so she went for a year without accessing her primary care doc. And she had been feeling a little funny and not quite herself, but you're unemployed, you're trying to find a new job, you're unsure about your future. So she didn't invest a lot of concern into how she had been feeling. Well, about a year later, she became employed and got employer-sponsored coverage and went finally to her primary care doctor. And the doctor said, I'm a little concerned about some of your labs. Well, it turned out that she was battling cervical cancer. She had gone on undiagnosed for a little bit longer than she should have. And despite having new coverage under her new employer, because she had been uncovered for so long, that employer-sponsored coverage told her they would not pay for her treatment because they considered it a pre-existing condition. So these are the kinds of stories that I see all the time as I'm out in the community and I'm doing my work. Her family had to take on, her parents, her siblings took on significant debt in order to be able to make sure she got the life-saving treatment that she needed, and she is doing well now. But they are still paying on that medical debt. So these are the kinds of stories about people who can't get coverage for, they couldn't get coverage for pre-existing condition, who are up against significant, really back-breaking debt because of the implementation of lifetime and annual caps and co-payments and deductibles. Some of that still exists, but the ACA really significantly changed that for all of us. So it's critical that we do all we can to support our federal delegation in their work to shore up the ACA, prevent its repeal, and really begin to look forward to how we can better implement how we pay for health insurance in our nation. It's critical to us all. We are born with a pre-existing condition, and that's called being human. So I encourage everybody to participate, to share your stories, to be a part of the effort to protect the gains we've made and to help move us forward as a nation. And I appreciate very much Senator Reid's action on this front, and appreciate all of the significant work that the community health centers do to take care of Rhode Islanders. Thank you.
So next we have our very own medical director, Dr. Andrew Sauls, going to say a few words. Andy?
Good morning and welcome. My name is Andrew Sauls. I'm the Chief Medical Officer here at the Providence Community Health Centers. For over 50 years, PCHC has been proud to serve the people who call Providence home. We are mission driven to provide high quality care to everyone, regardless of the ability to pay. And this is a very, very special week because last week, Florence Nightingale turned 199 years old. You all know Florence, right? I hear she's doing really good things. Florence is the mother of the modern nursing movement. And at the height of the Crimean War, she was chasing doctors around saying, remember to wash your hands. And she was the one telling the doctors, if you don't feed the patients and give them fresh air, they're never going to get better. We thank the nurses for doing that because it's extraordinary. We couldn't have health care without them. And so this, of course, is Nurses Week. So we gather today not only to celebrate the Affordable Care Act, but to celebrate our very own nurses. While I'm just a family physician, I am the proud son of a nurse, brother of a nurse, the nephew of a nurse, the cousin of a nurse, and the cousin of a nurse practitioner. There are 7 RNs in my extended family, and if I were to ever disrespect a nurse, my lifetime survivability would plummet the next time I went home. So today I'd like to remind people that the Affordable Care Act did more than just expand Medicaid. It reinforced nursing education programs across the United States. ACA dollars helped to foster new and innovative programs to better train the next generation of nurses to serve America. The ACA also expanded scholarship and loan repayment opportunities for nurses through the National Health Service Corps. Providence Community Health Centers is proud to participate in the NHSC and has 7 staff members now participating in this critical program. Without the NHSC loan repayment and Nurse Corps programs, mission-driven nurses with high student debt loads might have foregone primary care in lieu of higher-paying jobs.